Syringe feeding guide for foster parents. This guide is for kittens 4 weeks and older. Basics. Syringe feeding is a stopgap method of supplemental feeding when a pet isn't getting enough nutrition on their own. Syringe feeding can be used between 0 and 16 weeks of age for kittens, but between 0 and 4 weeks, the goal is to get them to eat on a bottle or eat from mom. The reason for syringe feeding is really going to dictate the length of time you'll need to support the kitten. So for example, kittens weaning, they just may need to make the connection between the food in front of them and them feeling full. They're just transitioning from milk to food that's on a plate. It may only take them a couple days for them to make that connection. For kittens who are sick with URI, they may feel congested, they may not feel like eating, and because they don't feel good, they might not have an appetite. So it may take a few days for the meds to come on board and for them to start feeling like they want to eat again. So you're doing a little bit of supportive feeding while they figure that out, while they figure out eating on their own, or while they just start getting better. There's also situations where they might have a medical condition like calicivirus where they have ulcers on their tongue, and it's going to take a few days to a week or more for them to get the ulcers healed, for them to feel good about eating on their own. Otherwise, it's uncomfortable, and they're not going to eat if they're uncomfortable. So they'll need help for that whole period of time. There's also situations of just stress. So kittens who are taken from mom, kittens who are in the shelter, and if they're scared, they may not feel like eating and they may go hungry, and because they go hungry, they feel poor, and then they don't want to eat on their own. So just getting them into a foster home and relieving some of that stress of the commotion of the shelter or getting past the stress of separating from mom can help them eat on their own. So they may just get to a foster home and start eating on their own the same day or the next day. So really the reason that they stop eating is going to tell you how long you're going to need to syringe feed for, roughly. And remember, when you're asked to syringe feed, the goal is to stop syringe feeding. The goal is not to syringe feed forever. We don't adopt out pets who need to syringe feed forever. The goal is just to get them to eat on their own. So you're going to do everything you can to make this syringe feeding excursion short, sweet, and very thorough. So again, if a kitten is identified as needing syringe feeding, it's because they aren't eating enough or anything on their own, and they're losing weight. We have to intervene in this situation. These kittens have to go to foster within 24 hours of starting syringe feeding due to the burden on shelter care staff and the time it takes to feed them, the stress on the kittens of being in the shelter and needing to be syringe fed, and then also the need for consistent monitoring from just one person or a couple of people. In the shelter, you may have 4 different people providing the care in one day for a kitten, and it's best if you can have one person taking notes and doing the work so you can keep track. And again, remember, most importantly, syringe feeding is just a stopgap method to get a kitten over the hump. You want to start it and then get them eating on their own so you don't have to continue. That doesn't mean to rush stopping. It just means you're not going to plan on doing it for a very long time. There's some environmental issues we also want to address when you're thinking about syringe feeding. So it's not just something going on with the kitten. It could be the way you have the area set up. We see this a lot in the shelter of if they just have a cubby, they may not have enough dishes. Also the stress around them. They may have too many kittens in the cubby. If it's a big litter, you have all sorts of different issues that can cause the need for syringe feeding. A lot of these can be remedied in a foster home where you have a little bit more space. If you're fostering in a bathroom or even just a large wire dog crate, you probably have more room than you might in a cubby. So things to consider are the number of dishes you have out, the type of dish you have, the placement of the dishes in the room, and then also the diet options you're offering, how the food is presented. And then there's also the idea of litter mate bullies. So talking about dishes, it's a good idea to have a few dishes of food out. You don't want to cover the whole floor with food because that's wasteful of food, but you want to have, a number of dishes out. So sometimes 2 or 3 is a good amount if you have multiple kittens. You want to have those be short dishes. These are just IKEA plates from the kids department. So you can use just a short plate. Ideally something that doesn't make a ton of noise if you step on it. And then something that's not high-sided, it's short, and then also it's flat. So you don't have to worry about them getting their, having to like reach really high to get their head over the side of the dish. That's, you can also, there's also ceramic and metal dishes like this that are easy to clean as well, but just consider a short flat plate is always better. The placement of dishes around the room is also helpful. So you may think that putting them all over the room can help, but if your kittens aren't using half the room, they may not know to go look over there for the dishes. So kind of get to know your litter of kittens or your group of kittens and figure out where are they going in the room and put food there. Also think about the presentation of food. So you can see here, there's two types of, it's basically the same types of food, but it's offered in 2 different consistencies, and it's also pushed towards the edge of the dish. So in terms of consistency, the one on the right is a little bit wetter. There's probably a little bit more water to it. And then the one on the left is probably just straight wet food that's just mashed up a little bit. You can also see here that there's actually 2 colors of food in the dish on the left. That's probably a combination of baby cat and AD. So it's likely that these kittens were eating AD. We don't want them to eat that long term. We want them to get them to eating baby cat. So we're just mixing in baby cat with AD to get them used to the taste of baby cat, and we'll add more and more baby cat over time so that they start eating that, because that's what we want them to eat. But what's most important is getting them to continue eating. You don't want to just do a straight swap and say, oh, just because you're eating on your own, start eating baby cat now. They may just stop eating altogether, and then you're back at square one. I got to syringe feed again. So do everything on that side slowly, everything related to transitioning on food. Do it slowly, offer multiple options to make sure they continue eating. Also, I can't remember if I just said this, but the food is pushed to the edge of the plate because cats' necks aren't long enough for them to reach the middle. So if you filled this whole plate, what you'll oftentimes see is that there's just a big wad of food right in the middle, and then the outsides of the plate are just scraped clean. So it's less wasteful if you just push everything to the edge of the plate. Also, if they're just learning to eat, sometimes the best way to get them to figure it out is to push the food over the edge of the plate, because they're going to take bites of the edge of the plate. They don't know the difference. So if you can put food on that, that might get them to take bites of the food and then put their head a little further. The other environmental issue that can happen is if you get a litter mate bully, which means basically one kitten who is really good at eating, they can make it really difficult for other kittens to eat. So even if you're putting out way more than enough food, but if you're putting it on one plate, that other kitten can make it unpleasant for the other kittens who aren't eating to eat. So he may run over, take a big bite, and then swat other kittens to go away. And then when he's done eating, the other kittens are like, well, I lost interest now, and they are not going to want to go eat. So adding multiple dishes around the room allows him to eat, continue eating on his own like the good little kitten he is, and allows other kittens to get the food that they need and not have to worry about being bullied. Also, there's a tendency to remove the bully and put the bully in alone. Sometimes it really helps to have a kitten who is a good eater in front of kittens who aren't good eaters, because that peer pressure of seeing one kitten go do something can make them go do something too, as long as it's a pleasant experience. Just like a kitten playing with a ball will make other kittens run over and try and play with the ball too. They'll do the same with food. So just make sure that you're offering enough options for them around the room. So appropriate weight gain is really going to depend on the age of the kitten. So kittens less than 3 weeks of age really need to gain 10% of their body weight every day. This presentation is focused more on kittens 4 weeks and up, the ones that are weaning. So those kittens really need to be gaining between 0.05 pounds and 0.15 pounds per day until they reach 3 pounds. At that point, their weight begins to slow, so you wouldn't expect huge gains every single day. But basically what our threshold is, we're looking for at least 0.05 pounds per day. For kittens that are 3 pounds and up, you might see kittens, they might lose weight one day and gain the next day, but you shouldn't have consecutive days of weight loss. You may also see a couple days of weight stagnation, but it'll pick back up on the third day. So just that's why you're monitoring, you're weighing every single day to find out whether the trend is up or the trend is down. For a kitten who's a half a pound, it makes a big difference if they don't gain weight. For a kitten that's 3-4 pounds, not gaining weight in one day, they're a little sturdier, so it's not going to have as big of an impact, but it's still good to make sure that you're staying on top of any weight loss or stagnation and keeping track of that. So this is how foster care staff are going to decide whether it's time to start syringe feeding, and you can use this as well. Basically what you're looking at is you're looking at your kitten and you're weighing them every single day, and if you see that 0.05 pounds per day or less than 0.05 pounds per day of weight gain, you want to start going through this this algorithm, this flow chart to determine what you need to do. So think about troubleshooting the environment. We talked about plates. We talked about whether there's a litter mate issue. You also want to see, is that kitten actually eating food on their own? You may have a litter of kittens that are devouring all the food, but then you see one kitten is standing back from the food or is taking a bite and then walking away. You want to actually be able to monitor that whole litter and see what's going on. Are they eating food? That kind of thing. So you're going to look at their appetite. For kittens that you see are not eating any food, if food's not getting eaten, they're not walking over to the dish, they're not interested in food, you are going to start syringe feeding if you see less than the 0.05 pounds per day of weight gain. And then you're going to reweigh in 24 hours. If you see a weight gain at that point, you're going to continue to monitor and supplemental syringe feed as necessary to maintain an appropriate weight gain. And then we'll talk about how to discontinue syringe feeding for that kitten eventually. If after that reweigh at 24 hours, you see a weight gain of less than 0.05, we want to make sure we're letting the vets know at that point, because it means that you're adding the right amount of food. You're feeding them 4 times a day. They should be gaining weight. There's no reason why they shouldn't be gaining weight. If there's situations like they have diarrhea or they're vomiting, those types of things, a vet needs to know about that anyway, so that we can address that separately. Back to the top, if you see that normal appetite, if a kitten is yes eating, but they hadn't gained weight, just go ahead and reweigh them in 24 hours, making sure you're leaving the food out in lots of different plates. You can put their face by the dish, put a little food in their mouth with your finger, that kind of thing, but you don't need to start syringe feeding that first day. Reweigh them in 24 hours. If they have gained weight, great, awesome. That means that you probably had just a weird day, maybe a big poop or something like that. Just continue to monitor. If they didn't gain that 0.05 weight, then you want to start syringe feeding and go through that right side of the pyramid that says reweigh in 24 hours after you start syringe feeding, then go to the weight gain. So this is really the tool you're going to use to tell you what you should do next. It's really helpful to know what you're seeing, so make sure you're keeping good logs. If you have a journal that you use for fostering, that's a great place to keep track of your weights, but also any notes you have about them. That's helpful. So what's helpful to note is if you see with your litter that you have less than 0.05 pounds of weight gain and you see worsening signs of disease, so URI is worse, maybe they're having if they were on diarrhea meds, maybe the diarrhea is significantly worse, things like that, you're going to want to let the foster team know so that they can get a vet involved. But this is going to help us if you've already started going through this whole pyramid, this whole flow chart, you have data for us. That's really going to help us troubleshoot a lot better and go right towards solving the problem rather than having to spend a few days trying to figure out the weight gain part and syringe feeding. So it's going to be the most efficient if you can start this journey on your own. Okay, so now we're getting to actually talking about syringe feeding. Before you get started, you're going to want to have some supplies, and we'll send this home with you, but you're going to want to have a syringe, And usually a 35 ml syringe with slip tip is best. So that's the syringe pictured here. So this is a 35 ml syringe. It has slip tip, means that it has that pointy tip. It doesn't have like the screw top tip for putting for fluids or for a needle. This is going to be the best way to feed a kitten because you don't have anything in the way. You can see what's going in and coming out. It works well. You want to have your wet food, your liquid, which we'll talk about what recipe you're going to use on, I think, in the next slide, and then towels, rags. You want to use your, have your scale ready, and then also any journal or whatever you're using to track your kitten's case. On the right side, you can see a few textures of slurry. The one you're going to use for syringe feeding is probably the one on the top. It's going to look more like melted ice cream. This is great for transitioning from a bottle or for those weaned kittens or those weaning kittens that are trying to figure out the difference between mom milk and taking bites of things. And then the two below are combinations of wet food plus some sort of liquid, some amount of liquid, depending on just depends on how much liquid you're adding to your wet food there. You're probably not using these for slurry. You may use the one in the middle. It may look a little bit more like that depending on what you're making. But the one on the bottom is going to be too chunky to fit through the syringe. If it's too chunky, you're not going to get it through that little tip, and you're going to be pressing, and then it's all going to spray out on the kitten's face, which is not fun for anybody, and it's wasteful. One tip is when you're leaving out a variety of textures of food, it's a good idea to leave out these three textures. So you've got your ice cream, your applesauce, your cottage cheese. It's also not a bad idea to just leave a can of a loaf, maybe cut into 3 pieces, but in the full form on a plate, because some kittens just want to take bites. They're going to have different preferences. And then eventually they may go to be more flexible, but sometimes a kitten's first food that's not mom milk is a giant bite of wet food. So offering more options is going to give the kittens a better chance to eat on their own. Now let's talk about recipes. There's a lot of different things you can feed to make a slurry. We have 2 prime examples. So KMR plus AD is what you're going to use for babies. And then, it's actually, this is not highlighted correctly. It's actually KMR plus baby cat, and then water plus baby cat. So the AD you're going to use only if instructed by a vet, but it's going to be KMR plus baby cat and water plus baby cat. So here you can see that the mix ratio is going to be 1 5.1 ounce can to 30 mils of liquid. If you know you have a litter of 6 kittens that are all getting syringe fed, you're probably going to go through a lot more than that in one meal. So just keep that with ratios up. Use 2 cans of food and 60 mils of liquid. And then the type of food and the type of liquid is going to depend on the age. So, and what the vets have recommended. So the default is Royal Canin Baby Cat for 4 to 5 weeks of age and 6 weeks and up. And then for 4 to 5 weeks of age, you're going to use KMR slurry. So KMR is going to be that it's kitten milk replacer. So you're going to add the wet food to the kitten milk replacer. 6 weeks and older, they're really, if they had a mom cat, they'd be probably stopping nursing around this time or not nursing as much. So it's okay to not feed them milk replacer. So you're going to use the Royal Canin Baby Cat and water to make your slurry. But you're still, in both situations, you're going to be using your 5.1 ounce can and 30 mils of liquid. We also may substitute Royal Canin GI Kitten, which is a wet food. We also might use AD, which is a wet food, Rebound, which is a dry food. And then there's a couple other options we might use as well, depending on the cat's case. So for example, if you have a kitten with terrible diarrhea, we may say use water and GI Kitten to hopefully help with some of that diarrhea. If it's a kitten who's really calorie deficient, very, very skinny, that kind of thing, our vets may ask to do AD plus water, AD plus KMR, but the default are those 2 things above. You need either baby cat plus KMR or baby cat plus water. How much to feed? So it's based on the kitten's weight, not their age. So because oftentimes if you're Syringe feeding, it probably means the kitten's under their ideal weight. So if you have a kitten who's, say, 1.4 pounds and they're not eating on their own, but they're maybe they're 8 weeks old, they would normally be about 2 pounds, but they're underweight. So instead of feeding them that at the 2-pound rate or the 8 or what you think you'd feed an 8-week-old, you're feeding them based on their current weight. So if they're 1.4 pounds, you can see they'd be eating between 25 and 30 mils per meal. And they're going to get 4 meals per day. So 4 meals a day until you start decreasing their feeds. Okay, so now the frequency. We talked about 4 times a day. And then as the kitten gains weight and begins to eat on their own, you can decrease the number of feedings. And this is the part we're going to spend the most time talking about. It's the hardest to figure out, but also the most satisfying. Okay, so when you're feeding, you need to know about your mechanics. So how you're holding the syringe and how you're actually going to go about doing it. It's can seem intimidating and seem scary, but once you've done it a few times, you get the hang of it. So holding the syringe, there's 2 options here. The one on the top is the preferred method because you have a lot more control over the syringe and where your finger's going. The one on the bottom is how you see doctors in television shows holding a syringe. You have almost no control over how fast the syringe presses. So if you have liquid in there and you're pushing, it's really easy on the bottom picture to just spray food all over the kitten's face. If you're holding a syringe like you do on the top, you're getting you're bracing the syringe a lot better. You're able to have a lot more control. So you're not going to go past your finger there. So as you keep pressing, you're going to move more of your fingers onto the actual syringe and off of the depression part. And so you're going to get a lot more food. You're going to get food out at the pace you want to get the food out. You also want to make sure you're using your dominant hand. So if you're right-handed, syringe feed with your right hand and hold the kitten with your left hand. For restraining your kitten, again, use your non-dominant hand for restraining the kitten, and you're going to have, there's a couple different methods, but you want to make sure you're holding the kitten's head. The kitten has basically 4 feet on the ground, or at least the 2 back paws on the ground. They should be having their stomach towards the ground. You feed a baby on their back, but kittens you need to feed on their stomachs. If you feed them on their backs, it's really easy for them to aspirate. So make sure they're basically feet down, just like you'd see them nursing on mom. And then the pace of the feeding, you want to go slower than you think you need to go. So if you are feeding and you're just kind of continue feeding, pushing, you're probably going too fast. It's probably going to be at the rate of like 1 mil. Right. 1 mil. Maybe even slower than that. You want to go at the kitten's pace, and you're going to watch them swallow and see what they like. It could be that after a few feeds, they start eating a lot faster. That's great. They're just getting the hang of it. But you can imagine if you haven't been syringe fed before and it's coming at you, probably feels uncomfortable, feels weird. You don't know what's happening, especially if you haven't ever had that kind of food in your mouth before. If you go too fast, there are risks associated. It's really easy for kittens who have their mouth really full of food to breathe it in and aspirate. So go slow, wipe the kitten's face, make sure you're going at the kitten's pace and don't rush it. Okay, so here's a demonstration. So you can see she's holding the syringe in a way that allows her to go slowly. She's probably going at the pace of like 1 mil at a time. See, some of it's coming out. And she's wiping her hands, and she's going to wipe the kitten's face a few times. You want to make sure you keep the airways clear. So if you get food on the nose, food around the mouth, it's hard for them to breathe. So make sure you keep that clear. So in that amount of time, she fed about 5 mils. So you can imagine it takes a while to do if you have a litter of kittens, it's going to take a while to do 4 feeds a day at 35 mils. So just be aware that it is a time investment, but the goal is for you to stop doing it. On campus, if we start syringe feeding before they go to foster, we're syringe feeding our 4 meals a day. We're weighing them before and after their feedings, and we can send this to you as well if you'd like, if you request your own version of this template. But we'll track the meal quantity and their weight, and so we can tell if they're starting to eat on their own or not. The other thing is we can also send this home with you when they go home, so you know if they've had, when they had their second meal, third meal, depending on when you're picking up. Another reason it's really important for them to get off campus is, for one, kittens are exposed to disease for long period, or just exposed in the shelter, could be exposed to disease. So it's good to get them off campus generally. But for kittens like this, it might be that meal 1 is fed by Katie, meal 2 is fed by Jessica, meal 3 is fed by Richard, meal 4. It's just, you can have a bunch of different people feeding, and if you don't have the same consistent eyes on the kitten, it's really hard to tell if this feeding went better than that feeding, this feeding went worse, that kind of thing. Okay, other notes about syringe feeding. It's messy, so be prepared, have your rags. Also remember that the timing of medications is important. So you may end up with a situation where you have a kitten who's on syringe feeding 4 times a day, but also on twice a day metronidazole, twice a day doxy, something like that. If you're giving oral medications, try and separate them out away from the food, unless they need to be given with food. The reason is that, especially for the first time you're giving the oral medication, but the reason is that the oral medication, they may decide to spit it up. They might make them nauseous. So if you just gave them a belly of 35 mils of slurry, and then you give them medication that makes them feel like, oh, I don't feel good, I'm nauseous, they may throw up the whole thing. So not only is it wasteful, but they haven't gotten their meal, they haven't gotten their meds, and now they're at risk of aspiration because they just threw up a bunch of stuff. So that's not a good thing. So try and separate out the medications from the food until you know that they tolerate both of them. For foster, it's really important to remember that although it's a lot of handling you have to do while you're syringe feeding, it's not always pleasant for the kitten. It might feel uncomfortable to be restrained, that kind of thing. So try and give them some cuddle time after or before, make it pleasant as much as possible. You can see in the video we showed the kitten was being restrained, but the person wasn't making it really uncomfortable, was trying to be a little bit loose with their hands, trying to give them the pace that they needed to go. If it's traumatic, that might not help them with their socialization with people. So give them the opportunity to have some cuddling time as well, playtime, that kind of thing. And then what's really important is cleaning up the kittens after each feeding. So this kitten is an example of a kitten who dunked their head in food. So, but I've seen this happen with depressing a syringe too fast, of spraying the kitten with food. But try and clean up the kittens as quickly as possible after each feeding. Don't give them a bath because that will chill them, but you can use a warm wet rag, and wipe the food off their face. If the food sticks on their face or stays there and dries, it can get really waxy, and you'll need to use really strong soap like Dawn soap to get it off. Also, it's really easy for it to just clump together and fall off, and hair loss. And again, we've probably heard this before, but if we see hair loss or you report hair loss, we're going to need the kitten to come in to get Woods lamp to make sure it's not ringworm. So it's just easier in the long run if you just can keep them clean as best as possible when you're syringe feeding. If you're using syringes over and over again, you can sometimes get 4 to 5 uses out of one syringe. Just make sure you're really cleaning them between uses. And if you start noticing that they're difficult to push down, difficult to pull up, just get a new syringe. It means that they're past their prime and they're not worth using anymore. And never reuse syringes between different litters. You should just use new syringes. We can supply you those. And then multiple kittens is usually better than one. We talked about this before in this conversation, but the peer pressure to eat really is real. So if you've got one kitten or a mom who's running over and eating food, they're just big copycats. So they might run over to eat food or try and copy the other cat if they see it. So don't be dissuaded by having a litter that has one kitten that needs syringe feeding and like a litter and the 6 others that don't. So it's best to just keep them together if you can at all, unless the work is just not doable. Sometimes it's just too much to syringe feed multiple kittens and keep track of them. Just let us know if you're feeling like you're overwhelmed. Please let us know. We'll help you decide what the best division is. And then the same instructions, this whole webinar, this whole conversation, the same instructions apply if you have a mom cat present. So you can have kittens that look like they're nursing on mom, mom's laying down, being great, but you see that their weight is stagnant or they're losing weight. This means that she's probably not producing enough milk, or her milk isn't doesn't have the same nutritional value or something. So you're going to need to step in to syringe feed until they can either get enough milk from mom or eat from a dish. If you have mom present, she may not like you syringe feeding. She may hear the kittens' cries and be upset about it. So you may need to take the kittens from the room and syringe feed in an area where they're not in earshot of her. But it's going to be really helpful, especially for that cleaning part after the feeding, if you can leave kittens with mom and not separate them or take the mom back to the shelter. Mom will do a lot of the work for you in most cases. So keeping them clean is a huge help. Also remember that our goal is still to get them eating on their own. So you want to leave out multiple food options between meals, and then remember to feed more of what they're eating. So try and target that. So if you see them eating only from the really, really liquid food, keep feeding that. Just keep giving that until you feel like it's consistent, and then add more wet food until they're eating what they need to eat. The goal is to stop syringe feeding. All right, so when to involve a vet? We talked about this when we looked at the flow chart, but basically you want to involve a vet if you see new or worsening signs of disease. So that would be worsening URI, worsening diarrhea, worsening vomiting, coughing, and then some lethargy. It's more emergent if we see things that are like difficulty breathing. That could be a sign of aspiration. Same with vomiting. If you see profuse diarrhea, so that's like dripping diarrhea, that could be a sign of Pan-Luc. Same with vomiting. If you see continued inappropriate weight gain despite syringe feeding, that could be a sign there's something else going on. So megaesophagus is something we want to rule out. There could be calicivirus. There could be all sorts of different things going on. Especially calicivirus would be a big issue if you see severe resistance to syringe feeding. So if they're really fighting you and it's really difficult, something else is going on there. It might be that they're really uncomfortable. Their mouth could be full of ulcers. So that's why we want to make sure a vet is involved. But if you've already started syringe feeding and you have your detailed chart that says like, I've been syringe feeding for 2 days, here's what I've seen, here's the weight gain, that's going to help the vets rule out a lot of causes, and it's going to help them get a better picture of the case. Oftentimes they just can't get a good picture of what a kitten is doing or what's happening with a kitten from a pet's intake records or from what we're seeing in the shelter, just based on how many people end up caring for the pet. So your records really are important, and your troubleshooting has been super helpful up until this point. Okay, so assuming you don't need to involve a vet, how are we getting to our goal? How are we stopping syringe feeding? So what's usually going to happen is if we tell you to start syringe feeding, or you know to start syringe feeding, you're going to do that 4 times a day, and you're going to weigh daily. Sometimes it's helpful to weigh twice a day so that you can really keep track of what's going on. On the shelter, we're going to weigh before and after every meal if we're syringe feeding, just so we know that we have a good baseline for that time that they're there. But weighing daily is really important. If you're monitoring that input like we saw on that flow chart, and you see that they're syringe feeding, they're actually eating food from the plate as well, and they're gaining weight, if you see those things, it's time to decrease feeding and drop 1 feeding per day. So the formula you're going to use is a significant weight gain, so that 0.05 or more pounds per day, and then you see the kitten actually eating. Then you can drop 1 feeding per day and continue to monitor their weight. If you need to weigh, if you weigh them and you see they're losing weight again, or they're not consistently gaining or gaining enough, add that feeding back. Add one feeding back, add more than one feeding back. And you will just keep going back and forth until you get to the spot where you need to be. This picture of kittens is a litter of kittens that had colici ulcers, and they needed to be syringe fed for 4 weeks as they were starting when they were 6 weeks old. So they were pretty used to it by the time they were ready for adoption. That was a long journey. So here's a sample case. It's kind of hard to read, but this is a foster parent's journal for a sample case to look at. The weight amounts might not be totally accurate with that guide, but the trend is the same. So let's look at the black kitten, for example. So you can see in the journal part below on 8/1, the foster parent picked up 3 kittens at 5 weeks old from the shelter. They were just separated from mom for health reasons for the mom. The kittens have diarrhea and are underweight. And then I've been asked to syringe feed KMR and AD at 30 mils 4 times a day. And then they also have these meds that I'm starting. Their fecal scores are 5 to 6. Notice I'm not putting fecal scores for each kitten because I don't know who's pooping. So this black kitten here going across the top, if I picked him up on August 1st, I always get a base weight here. So see if I can get the arrow here. So he starts off weighing 12.1 ounces. So this is in ounces. You're going to want to convert to pounds to go to the way that the vet team wants to be weighing, but you can make that conversion easily after the fact. So this kitten came home with 12.1 ounces. I fed him, since I got him at about 1 p.m., I had one feed in the afternoon and then another feed in the evening. So I did 2 feeds. The next morning he'd gone down a little bit, so he was 12 ounces. I fed him twice that day, so twice in the morning, and then in the afternoon I saw he did gain half an ounce, but because he was still underweight, I kept giving him I gave him 2 more feeds. So he got 4 feeds that day. On August 3rd for that kitten, man, he gained weight. That was great. So I dropped a feeding in the morning, and then I also dropped a feeding in the afternoon because he continued to gain weight, and I saw him eating. August 4th, I actually didn't need to feed him at all because you can see his weight is consistently going up. I felt pretty good. He's eating on his own. He looked robust. But then on August 5th in the morning, he lost weight. It could have been a poop, could have been anything, but he had lost weight. So I fed him once in the morning, and then he had a huge weight gain by the afternoon. So I felt pretty good about dropping his feeds there. And you can see he continued to gain weight. I continued to monitor him twice a day. And then by the 7th, I only weighed him once a day. For almost all of your kitten cases, you only need to weigh once a day, but if you're syringe feeding, you're going to get the best data if you're feeding at least twice a day. You also want to keep track of trends over time. So the net change for him is in just from the 1st to the 6th, he gained 3.8 ounces. That was pretty good. So then we're going to skip down, look at the calico kitten here. Calico kitten came home, actually no, look at orange kitten. So orange kitten came home as probably the big bully of the group, the kitten that was eating on his own. But because he came in smaller than he should have, or smaller than the vets would like, he started off with 2 syringe feeds that night. The next morning, I saw that he had gained weight, so I just did 1. He still gained in the evening, so I just did 1. But the next morning, whoa, he gained 1.5 ounces. Okay, that's huge. So I didn't do any morning feeds. By the afternoon, he had lost half an ounce, but it again could have been a big poop. So he got just one feeding, and I saw him eating though, so I knew just to feed him once. For the 4th, you can see that he's gained now 1 whole ounce overnight. That was great. And so I didn't feed, and then he gained 0.3 over the rest of the day. I didn't feed, and then I continued not adding feeds because he was continuing to gain weight consistently. And he gained a total of 5.1 ounces in that 6-day period. Looking at the calico kitten, you see she came home with 13 ounces. I gave her the 2 feeds, gave her the 2 feeds in the morning because she actually lost a significant amount of weight overnight. Again, there was fecal scores of 5, 6, so there's some significant diarrhea happening. And they had just been dewormed. It could be a lot of different things. So I fed twice a day, twice in the morning. And then I fed twice in the evening, even though I had an ounce gain, because it was still a net loss since the kitten had come home. The next morning, I saw an ounce and a half gain. That's great. So still underweight for the age, but that's an ounce and a half. So the kitten must be eating on her own. There's something happening there. Kitten continued to gain weight over the afternoon. So I only fed her once, but then was stagnant the next morning. So that's, it's red because it's red in that column on the 4th because the kitten had not gained enough, had not gained anything. She didn't lose, but she didn't gain. So I fed her twice. She gained by the afternoon, so I only gave her an afternoon or an evening feeding. I didn't do it twice a day. And the next day, you see she gained, and then she gained, and then she gained. So she continued gaining. The net change for her was 3.2 ounces over that 6-day period. So I felt pretty good about that group. And then you can see total feeds per day. I kept track of that too, because it's kind of a good indicator of making progress over a short amount of time. You can see the first day, August 2nd, the first full day was the hardest. 10 feeds was a lot for 3 kittens. I felt like pretty tired about that. But then on the next day, it was only half as many, and then half as many, and half. It's just continuing vanishing frequency for those kittens. So that was great. It's also good to see along the journal of what's actually happening. So on 8-3, last dose of Marquis, fecal scores 4. And then I kept track of what kind of food they like, that kind of thing. Anything you're keeping track of can also help you later on with another litter of kittens to give you some ideas of what worked, what didn't work. You're always learning, and anything you learn with this litter can help you with your next as well. And then also the celebration on 8-6 of I didn't feed anyone. So this is a great journal to keep track of. It's a good way to keep track of like your success and not feel frustrated and know that you are doing a great job. Okay. So now you've gotten everybody off of syringe feeding. You've met your goal. Congratulations, super exciting. Your kittens are no longer syringe feeding for now. Watch out for backslides. These are really common. So you might get kittens, and you'll see that you saw that on the last slide, you might get kittens who start eating on their own, you feel really good, and then something happens. Maybe a medication stops, or a medication is, maybe they add a new medication, something happens. They may stop eating on their own, or maybe the food you switch them out, they don't like. So watch for backslides, and then you may need to add syringe feeding again. But you can use that flow chart to decide whether you need to do it or not, whether you need to wait a day, just offer more options, that kind of thing. Always weigh your kittens daily, really, really important. We see a lot of kittens come in from other shelters we have no history on. We don't know whether they just were separated from mom. So don't take their age as meaning anything about whether they know how to eat on their own. So we've gotten 12-week-old kittens in who go in for spay-neuter surgery and then don't eat for 3 days afterwards, 4 days afterwards, because they've been nursing on mom this whole time and we didn't know that they were just separated. So weighing is really important. And then as you get them off of their slurry, begin transitioning them to more normal foods. Remember, we're not going to send a kitten home to an adoptive home on a syringe, and we're not going to send them home with slurry. So we need to get them on a food that an adopter will want to feed. So giving them the baby cat is something an adopter can buy at a store. Friskies, those types of things. We want to get them to normal cat foods that an adopter can continue. And that's the end. You did it. Congratulations, and super grateful for being interested in syringe feeding. It's really important. It helps our shelter care staff, and it's really, really a huge skill that helps save kitten lives.